Evening. Hello to our online audience. I'm Dr. Lynn Wu. I'm one of the pediatric urologists here at the Cleveland Clinic. And I wanted to speak tonight about a very common problem that we see in children, particularly in our urology department, and that is urinary tract infections, also known as UTIs, specifically related to infants, children, and teens. And tonight it will be myself discussing as well as Kim Slocum, one of our certified nurse practitioners. So our Department of Pediatric Urology consists of 6 active providers, and I wanted to introduce you guys. Myself is Lynn Wu, and then I have 2 urologic partners, Jessica Hannick and Jack Weaver. And we 3 are pediatric urologists. We perform surgery, and we work very closely with an excellent team of nurse practitioners who include Kim Slocum, who's with us tonight, Jenna Pitts, and Brianna Amato. And between the 6 of us, we do our best to cover Northeast Ohio. So typically we could get a location that's fairly close to home and hopefully convenient for you and your child to be seen. So just some background, what is pediatric urology? Sometimes just even in the medical field, it's difficult to explain or have people be familiar with what we do. And so specifically a pediatric urologist is someone that manages conditions that involve problems with the urinary tract and also reproductive organs. And we specialize in treating babies, children, and teenagers. And we will go up into young adulthood. Typically by the time kids are in the late teens to early 20s, they're considered adults and have more adult type anatomy and adult type issues. And we're happy to help you guys transition as well to an adult provider if necessary. Urologists are both doctors, so we see children in a medical setting. We provide medications and treatments, but we're also surgeons. So one of the unique aspects of urology is our ability to have sort of a combination practice. And many of our children don't require any surgery, but when they do, we're able to provide that. And our training is fairly lengthy. We, in addition to college, do 4 years of medical school, 6 years of residency, and then 2 additional years of what's called fellowship, just to take care of kids. And our team is composed, as we stated, of doctors and specialized practitioners who have lots of experience and expertise in taking care of the urinary tracts for our children. So what do we treat? So obviously we do treat urinary tract infections, which is what we're discussing tonight, but we also take care of congenital anomalies. So these are most commonly known as birth defects or things that babies are born with from the start of life. We also treat bladder dysfunction, and as you'll hear later from Kim, bladder dysfunction and urinary tract infections often go hand in hand. So there often is a relationship between the two. We also take care of urologic cancers, which fortunately are rare in children, and then kidney stones. So both kids and adults can get kidney stones. So what are UTIs? These are very common problems, and the most common symptoms are pain and urinary accidents in kids who otherwise wouldn't have problems with urine leakage. The good news is most kids who have one UTI don't go on to have repeated infections. However, in kids that are having problems with recurrent urinary tract infections, that might be a sign that something more serious is going on and that potentially being a urologist is necessary. And so a UTI happens when bacteria enters the urinary tract, and it comes in most commonly through the urethra, which is where the pee comes out. Once the bacteria gets in the bladder, which is normally a sterile environment, then you can get inflammation of the urethra, you can get inflammation of the bladder, and sometimes that infection can actually ascend and go up to the kidneys. And so all of this inflammation is what leads to a lot of the symptoms that are encountered. Who gets UTIs? So you can get a UTI at any age. Babies can get UTIs and adults get UTIs. The younger you are when you get your first infection, the more likely that we might be suspicious that there could be some kind of congenital problem with the urinary tract. Girls tend to get UTIs more often than boys, and a lot of this is just related to the differences in anatomy and how closely located the urethra in girls is to the anus, which is where we poop from. And the anus and the poop is usually where a lot of these infections can start. Boys can sometimes get UTIs, and uncircumcised boys do have a higher risk. And we think that's because the foreskin, which is normally tight in many babies and young boys, can make it hard for cleaning to take place and bacteria can build up there. And you may not think about this, but children that are constipated definitely have an increased risk of getting urinary tract infections. And that's because the bacteria that cause these infections normally live in the poop. Poop can also put a lot of pressure on the bladder and lead to problems with the bladder functioning in a normal way and lead to sensations of feeling like you need to urinate all the time. So what are the symptoms? So most people are familiar with the fact that you can get painful urination. Most often kids complain that it burns or that their pee is hot, but it hurts to pee. Urination might be more frequent than normal, so they feel like they aren't quite done or that they have to go back right after they finished. They might have urine accidents or have bedwetting, and this is particularly a red flag in a child who doesn't normally have issues with accidents or is fully toilet trained. Urine might be foul smelling, so parents might report that it's really strong or the odor's really bad. You may see blood in the urine or the urine might have a dark color. And children might develop abdominal low back pain or sometimes pain up in their sides. And then in some cases, kids can get fevers. And any one of these things could be a sign of infection. Sometimes they come in combination. And so any one of these things may not be enough to make that full diagnosis. Oh, and nausea and vomiting. So how do we diagnose the UTI? So those symptoms can definitely make one suspicious. We're going to be looking for the bacteria that we talked about causing the infection. And the best way to test is by urinalysis. So this is a sample of the urine. The best way to collect this in a child that's able to pee and is toilet trained is with what's called a clean catch specimen, meaning that you pee a little bit and then you get some cup that goes under the pee and you catch it midstream. You try to avoid catching it in a different container or in a hat or having urine that's dripped off of the body because this can lead to some contamination. In a child who's not potty trained, like a baby, then the best way to collect this is with a catheter, taking it directly from the urine in a sterile fashion. The urinalysis is the first test, and this is done with a dipstick, and it's a quick study that can take place within a few minutes of collecting the urine. But the gold standard to determine if there's an infection is a urine culture, where the urine specimen is actually sent to the lab and grown to see what bacteria results. And then this way we can test for specific antibiotics. How do we treat infections? So infections are typically treated by an antibiotic, and the culture is helpful because it lets you know that you're on the correct antibiotic. And the antibiotics kill the bacteria, treat the infection. And even after the bacteria are eliminated, it could still take weeks for the bladder and the rest of the urinary tract to completely heal. So sometimes kids can still have symptoms afterwards that can linger for several weeks. During this time where it may still hurt to pee or where their urinary habits may not be back to normal, you're also at a risk for getting another infection during this time. So we talked about how recurrent infections might be the sign of something else going on. So what could be other things that contribute to UTI? So the top things that we as urologists see are ureteral reflux, which is where urine actually goes backwards from the bladder up to the kidneys because of a faulty valve. You could have a blockage in your urinary tract somewhere from the kidneys all the way out to the urethra. You could have kidney stones, which can cause blockage, but can also be a place where bacteria live and hide. Or there could be an abnormality of the genital organs or bowel and bladder dysfunction. And so we talked briefly about reflux, and here's a diagram of the urine going backwards from the bladder up to the kidney. Blockages anywhere from the ureter, up high in the ureter, or down where the bladder empties can lead to poor drainage, and this can increase the risk for infection. Or kidney stones, which can cause the blockage or act like a place for the bacteria to hide. And specific issues of the genital organs are things that we would diagnose in combination with your pediatrician. So I'm going to hand the talk over to Kim Slocum right now to discuss a little bit about how bladder and bowel dysfunction can contribute to increased risk of UTI.
All right. So Dr. Wu talked a little bit about, bowel and bladder dysfunction. Oftentimes when we see this, kids are not emptying their bladder and their bowel appropriately. They tend to hold both their urine and their stool. Oftentimes we'll see kids going for multiple hours throughout the day, perhaps even the full school day, without going to the bathroom to urinate. As well as with bowel movements, we may see them going several days to even only once a week that they're having a bowel movement. And these kiddos typically have bladder and bowel dysfunction. Generally speaking, the pelvic floor isn't working appropriately. It's not working for them, it's actually working against them. And they have a harder time relaxing their pelvic floor to be able to empty both their bladder and their bowels. So when we see this, oftentimes we don't see problems right at first, but as kids continue to hold both urine and stool, in the long term, we tend to see problems with incontinence, pain with urination, urinary tract infections, urgency, frequency, and of course, constipation, sometimes also some stool incontinence.
And if I can just add, the diagram here kind of shows that the holding behaviors do create kind of a bad cycle. And so it can be very difficult to get on top of things because once a child's holding something, it becomes more uncomfortable to release it. And so then this perpetuates or adds to that problem of wanting to hold more because the child starts to associate going to the bathroom with something negative and painful. So it can be pretty challenging to what we say break the cycle or identify that this is a problem and try to get on top of it.
And so then when we're evaluating children for UTIs, Dr. Wu had already talked about the urine tests that we would do, urinalysis and urine culture. Depending on what may be going on with your child, we may end up doing an ultrasound. We may end up doing a VCUG or a renal scan, other lab studies like some blood work or further urine testing, urodynamics, which is a bladder function test. It helps us to understand what's going on with the bladder and what your child is feeling at each stage of bladder filling and bladder emptying, as well as sometimes an MRI or a CT. Each of these studies will give us a little bit more information as to what's going on. And as Dr. Wu had discussed a little bit before, these are not something that each child is going to need to have. However, in those kiddos that are having those recurrent infections where we're worried about something more serious, that's when we start to do some of these tests. So then we come to, what are the treatments that we like to do for kiddos with UTIs? We always try to start very simple, very educational based, try to work on lifestyle changes, behavioral management, what we consider urotherapy. So talking about, when they're going to the bathroom, how they're going to the bathroom, different things that they're eating and drinking, and trying to change those things around. We also sometimes have to do medications, of course, medication if we need to treat an active UTI, but sometimes we have to do medications and or supplements to help prevent UTIs in those that are having recurrent infections. And last would be surgery. This, of course, would be to correct one of those underlying abnormalities that we would find on the further testing, such as, the reflux or a blockage of some sort. We do have minimally invasive options that we can do for each of these procedures if needed. And then, of course, we would have our pediatric anesthesia team with us to help take care of these children. So this is just a little bit more about the urotherapy. So I touched just a little bit on the fact that when we talk about, how kids go to the bathroom, when they go to the bathroom, making sure they're emptying their bladders appropriately. The biofeedback here actually helps kids to work on their pelvic floor. So we talked about the pelvic floor dysfunction or the bowel and bladder dysfunction. So this helps to teach kids how to urinate the right way. What we do for biofeedback is we actually have them, come into the office for several sessions, usually somewhere around 4 to 6 sessions. And we hook them up to the biofeedback machine here. Everything is external. There's some leads that we call stickers for the kids that go on their abdomen and as well as on their bottom to help us get a read for their muscle activity. And we have them actually play some games with relaxing and contracting their pelvic floor so that we can understand perhaps where the disconnect is and how we can help improve that. And then, of course, we do send them home with a little bit of homework because, coming into the office just once a week or once every other week is not typically sufficient. We do have to ask that they do a little bit of work and families do a little bit of work with them at home.
Thanks, Kim. That's great. We really think
Mhm.
that the biofeedback in urotherapy is one of our best weapons when we diagnose bowel and bladder dysfunction. Sometimes these abnormal pelvic floor behaviors, they're not something that's done consciously. So your child isn't necessarily doing it on purpose, but it's something that happens over time, probably as a defense mechanism against the pain or some other experience that's occurred with bowel movements or urination or a prior infection. And so we find that this is a particularly good holistic way to kind of evaluate and treat the bladder as opposed to using lots of medications or doing repeated antibiotics. If we can get to the root of the problem, which is what the biofeedback hopes to do, and teach the child a way in which to urinate and relax and contract their pelvic floor in a normal way, hopefully we can kind of fix the problem that has been contributing to the infections and the leakage. Thank you, Kim. So how can I prevent UTIs in my child? We get this a lot. And sometimes there isn't anything as a parent that you can do, even if you've done the right things. And that's why seeing our urology team may be important if we're having problems with recurrent infections. However, there are things that you can do to try to decrease your overall risk. So number one, pee frequently. So we do want our children to be urinating at least every 3 hours while awake. Kids may often say that they don't feel the need or that they don't have to, but it is true that holding the urine too long can increase the risk of bacteria staying there too long and causing an infection. It's important that you take your time when you're in the bathroom. So try not to be in a rush. Everybody wants to get back to what they're doing, kids included. But after peeing, we'd like them to sit, relax, count to 10, and see if there's any more pee that comes out. We've already talked a lot about trying to avoid constipation. And so eating healthy, keeping a lot of fiber in the diet is important. And as part of that, you want to make sure your child is adequately hydrated so that fiber can work. That means drinking plenty of liquids, especially water, and avoiding things like pop, juice, and high sugar beverages. And then keeping clean, practicing good hygiene, bathing routinely, and changing underwear just to keep the overall hygiene down in the private area as good as possible. So just we're going to move into some of the commonly asked questions that we in urology get. Some of these are kind of, I'd say, myths that have been passed around. So we wanted to address that. The first one is, does cranberry juice, is it good for the urinary tract or does it really help with infections? And interestingly, there really aren't any good studies that have shown cranberry juice or supplements can actually treat any kind of infection. So um, it probably doesn't hurt to drink cranberry juice, but most of the studies that have looked at it haven't been with the cranberry juice cocktail. It's been with raw cranberry, which can be very difficult to drink because of the taste. And likely this won't have any effect if there's an active infection. The second question is about prevention. So people have always said, oh, I think something's happening, or I've had a lot of infections, let me drink cranberry juice. And there was some suggestion once upon a time that maybe cranberry juice would be helpful. But to date, none of the studies that I've reviewed have shown that cranberry juice is more effective than a placebo or a non-treatment in preventing your overall risk of urinary tract infections. So the next thing is, do you recommend probiotics? There are a lot of different probiotic brands that you can buy online or buy in the pharmacy, or buy in health food stores. And there are some studies that actually show probiotics can decrease the overall risk of infections. In these studies, though, there hasn't been an overwhelmingly strong effect. And so right now, I don't disagree with probiotics. I think there probably are health benefits from a gastrointestinal and digestive standpoint, but there isn't enough evidence for me to say that it's going to reduce the risk significantly. There is a substance called D-mannose, which we will sometimes recommend, and this is a simple sugar which is found in fruits. You can purchase this over the counter in a powder form or in capsule form, and this has shown some evidence of reducing the risk of UTIs in children. And then one of the most common questions we get is about bubble baths. So at the end of the day, we don't feel bubble baths cause UTIs. However, the soaps and the perfumes that are seen in the bubble bath can lead to irritation because the tissues of the urethra and vaginal area, particularly in little girls, can be very delicate. So if those tissues get irritated by the fragrance or the perfume, and the patient has redness or pain and doesn't want to urinate, that can either mimic the sign of infection, or if the child's holding, could ultimately lead to infection. So it's not the bubble bath causing it or bacteria within the bubble bath causing it, but it's more the irritation leading to behaviors that could then predispose to an infection. I don't tell my patients not to have bubble baths. However, I think it's very important, if you do have a bath, that you make sure you rinse the area very well with fresh water before coming out of the tub. And it's also important to do this after swimming, whether it's in chlorinated water, salt water, or in otherwise ocean or fresh water. Another question we get is, how much water should my child drink? And so this largely depends on the age of the child, but we would encourage 3 glasses for the toddlers, 4 glasses for the grade school children. And then as you're getting into middle school, we're up to 6 glasses. And then once you become a teenager, particularly when you're active in sports, you do want that 8 cups a day. And that's kind of what we put down for our adults. So by that point, making sure that you're getting 8 glasses in is very important for maintenance of urinary tract health. So what are our take-home messages today? Urinary tract infections are a really common problem, and there are some special tests that are fairly basic, but we do need these to make a complete diagnosis. Antibiotics are used to treat UTIs once you've confirmed that there is an infection, and sometimes UTIs can be a sign of an underlying problem. If you think that your child's suffering from recurrent infections or symptoms that sound like infections, then we're here to help in pediatric urology. I'm going to try to see if there's anything on our chat board that has come up. All right, okay, so we've got a question here. If you have recurrent UTIs in childhood, are you more likely to get them in adults? That's a great question. Evidence would suggest that possibly you may, but it's interesting because when I see children for UTIs and I talk to their mothers, many of their mothers can remember having UTIs themselves as kids, but things seem to get better as they get older. I think the issue is that there are a lot of different things that happen as we grow. There's different changes in our hormones, different changes in our medical conditions that can predispose. So it probably is overly simple for me to make a blanket statement about it. So I guess at the end of the day, I'd say it's possible. And if there was an underlying, I'd say, congenital defect that you knew you had as a child, there may be a need to see an adult urology specialist to address that. But if it's something that's you just always have had UTIs and respond to infections, there are sometimes biological things about just how our bodies respond to bacteria that can be at a more genetic level that we may not be able to figure out. So I don't think it's a general rule that as kids, you're going to for sure have them as adults, or that adults who have problems necessarily have them as kids. Another question that's been raised is, when should a parent get concerned about a UTI? So I think that UTIs come in a variety of severities. And I think that any parent's going to be concerned if their child's showing some symptoms of being uncomfortable or having problems with their urination. The biggest red flags that we worry about in young children are if they're having high fevers, if they're unable to keep down fluids and stay hydrated, or if their urine becomes very dark or very concentrated, or they're not urinating a lot. Those are all reasons to seek more prompt care. If your child is very young, this may need to be an emergency room or an urgent care. If your child is more school aged, isn't having serious symptoms, a pediatrician is going to be very familiar with how to at least start the diagnosis and the treatment. And sometimes it's your pediatrician that can then ultimately decide whether pediatric urology referral is appropriate. All right. Well, if there's no more questions, we can conclude this presentation, but I hope that this has been informative, and our team will make sure that there's information on how to get scheduled or how to reach out if you have any additional concerns or questions.